We can do it, yes we can. Become the leading star. Putting our patients first will make MIOT lead by far.
We work as one family. We work hand in hand. We work to make our nation proud. We'll be the best in the land.
Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far. Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far.
We heal with pride and passion. We heal with faith and love. We heal with truth and harmony. As sure as God's above, with God sent to guide us, all skills grow day by day. Putting smiles on people's faces, that's the MIOT way.
Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far. Putting our patients first will make MIOT the leading star. Putting our patients first will make MIOT the best by far. We can do it, yes we can. The best by far. We can do it, yes we can.
We can do
The
it.
leading star. We can do it, yes we can.
Yes, we can.
The best
With
by far. We can do it, yes we can. The leading star.
Good morning, everyone. I welcome you to this webinar on reclaiming life from Parkinson's. Good morning, doctors. We have with us today Dr. K. Subramanian and Dr. Shankar Balakrishnan. Both of them are from MIOT International. Both of them are neurologists. Dr. K. Subramanian, with over 20 years of experience in the field of neurology, he has treated thousands of patients with neurological problems, including Parkinson's. His passion for the field was such that apart from treating patients, he has also shared his expertise with students, having taught for over 10 years. His primary focus is on Parkinson's, neurocritical care, infections of the central nervous system, and headaches. Dr. Subramaniam completed his MBBS from Stanley Medical College and his MD in internal medicine also from Stanley Medical College, and he completed his DM in neurology from Madras Medical College. Welcome, Doctor. Dr. Shankar Balakrishnan, an intervention neurologist, completed his MBBS from Stanley Medical College and did his MD in pediatrics from NHL Medical College, Gujarat University, Ahmedabad, and is also he did his DM from the Institute of Neurology, Madras Medical College. He is a young and enthusiastic doctor spearheading movement disorder clinic at MIOT International, one of the leading deep brain simulation specialists in the country with nearly 30 deep brain stimulation surgeries to his account. He is also specialized in treating vascular disorders of the brain. An active member of the neurology academies nationally and internationally, he has authored and presented research papers in various national and international forums and co-authored research articles published in international journals. Welcome, Doctor. Uh, we will start the session without much ado. Dr. Shankar Balakrishnan will make a presentation and then we will go on to a panel discussion in which both the doctors will participate. May I request Dr. Shankar Balakrishnan to please make his presentation? Dr. Balakrishnan?
So the World Parkinson Day on April 11th, every year there is a lot of activities and efforts to bring what is Parkinson's disease and what how we should understand the disease before we fight against it. So World Parkinson disease is something very important. Why I'm telling this is because this disease occurs in patients mostly around the age of 60s. So someone in the family, when they get slowed down, when they complain pain in the joints, when they are not able to speak in high volumes, and when we see that they seek help to carry out their daily activities, we often blame that is due to because of the aging. And sometimes we call it as because of old bones, and sometimes we call their even their memory disturbance as these are senior moments. So since most of them fall in the spectrum of 60s, we often blame these problems related to age. Some of these things can happen with age, but we have to have a closer look, like what is Parkinson's disease. And Parkinson's disease is wide. It's not a rare disease. It affects more than 6 million globally. And then if we take an Indian scenario, like 1 in 50 family, like some will have Parkinson disease. And why we get this disease, there is a nucleus called substantia nigra deep inside the brain, in which an important neurotransmitter, we call it as a chemical messenger called dopamine. These dopamine are produced in the cells, and the cells die before the age they actually should live. And why this is happening is inside these cells, there is some clumps of abnormal proteins, which we call as Lewy body. These Lewy bodies are clumped abnormal proteins that stays inside the cells. These misfolded proteins tend to aggregate and they form a strong bond to form an abnormal protein which cannot be degraded by our body systems. So these proteins tends to accumulate slowly over years and the cells doesn't work properly and they die and fail to communicate with each other. Our protective mechanisms, the proteasomes and the autosomes, which are the fighting cells, they fail to degrade these proteins and resulting in Parkinson's disease. See why and what is the cause for the Parkinson's disease? This is something like every running in everyone's mind. It is a combined factor. Both the genetic and environment has a role. And even sometimes the head injuries can cause Parkinson's disease. So it is always an imbalance or the balance or the complex play between the genetic and the environment. Genetic definitely has a role which causes problem in clearing these proteins. And a lot of research is also going with the genes to find out a complete cure for Parkinson's disease. Environment factors, of course, pesticides, chemicals, polluted airs, often heavy metals used in treatment can also cause Parkinson's disease. So the risk of Parkinson's increases with the age. People above the age of 60 are most commonly affected. They form the majority of the group with Parkinson's disease. But there is some hidden fact that people even around 40s or even less than can also have Parkinson's disease. The younger the age, there is more thing with genetic role has an important in younger age with Parkinson's. When you talk about the classic symptom, tremor is a very predominant symptom that starts on the one side of the body. The tremor can affect the legs, the chin, and even upper limbs. Second is about the stiffness. The body becomes so rigid like a pipe. It's very difficult to bend or flow of movements can happen. The third most important thing is the slowness of movement. It's very difficult to make even a small step. This is called the slowness. Dopamine plays a role in the speed of the body, so they lack dopamine. And then the fourth cardinal symptom is about the balance of the body. So they tend to fall even with a small obstacle. There are many non-specific symptoms like constipation, sleep disturbance, memory disturbances, and sometimes they feel very low and sometimes depressed. So there are clumps of symptoms which we need to think, and doesn't stop with that. There are many symptoms like speech changes. They can't talk loudly. Sometimes the facial expressions get reduced and reduced blinking, the reduced arm swing while walking, and their handwriting becomes narrow. So most of them have anxieties and sometimes delusion, and the memory also get compromised in Parkinson's disease. So when someone faces these problems, they take medications, and medications can also produce some symptoms. And very weird symptoms like impulse control disorder is like gambling, making them to spend a lot, binge eating, and abnormal sexual behavior can also be a symptom of Parkinson's and the medicine itself. So when we talk about Parkinson's disease, there are five stages. It's called Hen and Yahr staging. So why it is important is the treatment is going to depend upon the stage of the disease. The stage one, only the one side of the body develops the symptoms, maybe slowness or tremors. In stage two, the same symptoms picks on the opposite side. And in stage three, the balance becomes an issue, but still they can walk without an assistance. And in stage four, they completely become dependent. They need without an aid or without an assistance, they can't move around. And stage five is the worst stage, like they will become completely wheelchair or bedridden. So these are the five stages of Parkinson's, and every patient has to pass through these five stages. So when they become dependent, the quality of life is compromised. So when it happens in the end, the story is completely different. They will be completely dependent on someone's for them to even rise from the chair. They feel dependent for their daily activities, even for dressing or to bath, become completely dependent. And when we need supports, there should be always some one or two person beside them to carry out their activities. So the stages of Parkinson's flows, like we call the early stage as stage zero is asymptomatic, stage one, the one side of the body, and stage two, like both the sides gets affected. For early stage, it's easy to manage with a little bit of medications and exercise. They will be able to carry out. But when stage three and stage four comes, even the medications can induce the side effects which are intolerable. So they need some sort of support. And when they become stage five, we call it as advanced Parkinson's. They become completely dependent. So diagnosis is the one which is very important and challenging. Not like other disease, there is no single bullet to diagnose Parkinson's disease. So we need to differentiate many other conditions which mimics Parkinson's disease. That's the most important thing. And Parkinson's disease, the telltale signs of Parkinson's, the tremor, the postural instability, the stiffness, and the rigidity. The four symptoms are very, 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 very important, and they are going to make the diagnosis. Not expensive scans, not expensive genetic tests. It's always the clinical history which helps. So once we feel that there is something wrong with our family members, consult a neurologist or a movement disorder specialist who takes more time, who spends more time with taking the medical history. So the diagnosis is hidden inside your medical history. The diagnosis doesn't comes out from expensive investigations. So when we go through the medical history, the family tree, the family members will give as like, yes, he got slowed down 2 years before. It was not like that. He got memory problems now. So they will come up with a history. And there is definitely a genetic role and environmental exposures. Only these things can be picked up from the history. So once the physician or the neurologist examines him, the type of tremor varies with the disease also. So like no, tremor is not only with Parkinson's disease, there are many other disease which mimics Parkinson's can also have a tremor. Only a movement disorder specialist or a neurologist will be able to differentiate whether what's the type of the tremor, whether it is related to Parkinson's or something else. It comes only from the examinations. So if you bring a clump of reports and ask whether my distant relative is having Parkinson's, the doctor may not be able to answer. They want to see the patient. They want to examine the patient. That tremor is very, it's called as a pill rolling tremor or the resting tremors, which changes with the posture. So tremor gives a lot of information in diagnosing. And also grading. When someone develops the chin tremors, it indicates the disease is very severe. The classic walking is called as hunched or stooped up posture. It makes them bend, and then the face the face becomes expressionless, and none of the bodies there is no free flow of movements. It becomes completely like a board. It's very stiff. And when you examine the face for a little while, there won't be any blinking. The blinking rates will be gone, so they won't blink, and the expressions becomes very narrow. It's very difficult for them to even bring a smile on their face. So the physical examination gives a lot about the diagnosis. Do we do scans? Yes, we do an MRI scan only to exclude something else. There are many diseases, as I said, there are many diseases which can be similar to Parkinson disease, but an MRI is helpful only to exclude the similar conditions. If someone asks if I want to confirm with some investigations, then comes a role of an advanced scan called DAT scan or a Doppler scan. So what we really do is we inject a dye which contains dopamine. It gets bind to the cells which to the receptors. So when they bind to the receptors, they emit this radioactive molecule, and we capture with a gamma camera. And when the one on the left, which is like a semicolon, is classic normal pattern. The other opposites is like when there is a decrease uptake, you won't see the classic 2 comma. It's called as a 2 comma sign, and that becomes reduced. And it also helps in grading the stage of the disease, and also differentiating similar conditions which mimics like Parkinson's disease. So like when we diagnose Parkinson's disease, what is more important is there are some hidden non-movements like hallucinations and life-threatening complications. So once we tell like there is Parkinson's disease, everyone will have a fear because this disease doesn't have a cure. And everyone, when diagnosed, they will be more anxious to know what will happen to them. Is it a life-threatening? The Parkinson itself will not kill anyone. But there are two factors which are very dangerous for them is the swallowing issues, which can lead to aspiration. So what is aspiration is, as you see in this image, like it's an advanced imaging, and the patients try to swallow the food particles, the liquid, instead of getting into the stomach, it tends to get into the airway. So this stays inside the lung and it creates a lot of reaction resulting in pneumonia. So that we need to spend a lot about in addressing this swallowing issues apart from writing just a medication for Parkinson's. So levodopa can effectively manage, but although like there are intolerable side effects. So levodopa is a magic drug, but it do have its own side effects. And not every Parkinson's experience tremors. It's a highly individualized, and the symptoms varies from patient to patient. And what is more important, it is progressive, but definitely not a death sentence. So we should know the facts before treat like knowing what is Parkinson's disease. And how do we treat Parkinson's? When it comes to the point of treatment, so two important factors the physicians will look at is what is his degree of progression of disease and the degree of symptoms. Based on this, we will decide about the treatment. So the initial part of a disease, like in Hen and Yat staging 1 to 2, the neurologist or the movement disorder specialist will discuss, will motivate them to do a lot of exercises and a little bit of medications to keep their normal daily activity normal. So It's a completely and like an interview and no and a physical examinations and just medications and exercises. And we will do a little bit of increase. We need to play with the medications to control the motor symptoms. So as I said, what is motor symptoms is something to do with the movements, like the tremor, the stiffness and slowness of movements. These symptoms are called as motor symptoms. So the motor symptoms can be easily tackled with the help of medications. So when we talk about medicines, mainly three group of medicines. One is the dopamine agonist, another is called as MIOT inhibitors, another is the levodopa. What is like dopamine agonist or good for the initial stage of the disease? Levodopa is a magical drugs which will work in all stages. Depending on the patient's need, we introduce levodopa. And MOM inhibitors, what it actually does is it extends the action of the dopamine in the brain. When the disease progress, the motor symptoms also gets worse. It's not like a single prescription which is sufficient to carry out their entire life. The motor symptoms also will worsen as the disease progresses. Then what we do, the levodopa. So we change the frequency, we increase the dose, we increase the numbers, and we try to extend the effect of levodopa with another group of medicines like rasagiline or salicylic. So at one point in time, what happens is when there is too much levodopa, it brings about unwanted movements. So it's always a balance between an on time and an off state. On time is completely normal, able to carry out their daily activities. Off state is they become dependent. So the treatment is always a balance. When we give and they take more levodopa, there are a lot of unwanted movements. As you see in this video, the right hand moves on its own, producing a dyskinesia. So what when we do like we try to adjust again, we need to reduce a dose, and there are medicines which can counteract these unwanted side effects. Amantadine, it's actually a viral drug which definitely helps in controlling the unwanted side effects. So this is a chart which will say about the fluctuations in the disease. And when we come to a point that is more when it more complex problems, you cannot balance between the side effect of the medicine and the things. There's another medicine called apomorphine. So what is apomorphine? Is a derivative of morphine, but actually helps in Parkinson's disease when there is a high fluctuations when you couldn't balance it. So it comes in insulin, like insulin pens. It comes in infusion pumps. So this which maintain the level of drug in the blood at a steady state. That's the benefit of this thing. So once the stages progresses at one point in time, we can consider apomorphine as an alternate, because we need to push whatever be the disease or symptoms. They have to be independent, they have to carry their normal daily activities. So this infusion actually delivers the medicines in microdoses through a small pump. So with this pump, the doses will be steady in their blood and there won't be any fluctuations in their disease state. So this is ambulant, and the patients can carry in their like a pouch, and then they can carry out. And for every patient, the dose varies. So the doctor admits the patients, fixes the doses, and then she can sit in the pump at home, and then he can walk around with apomorphine. So when do they have a better remedy? Can they get back their normal life when the stage of disease progress? So what is important? That comes the role of deep brain stimulation. These nucleuses inside the brain, they talk to each other to regulate the movements. And because there is no dopamine, they talk through dopamine moves around, they produce an electrical current, and those electrical current helps in carrying out the circuit problems. So what we call as circuit problems like Parkinson's disease, essential tremor, dystonia, all these can cause circuit problems. So where we place a small battery beneath the collarbone, this sends signals to the brain and the nucleus, which they stimulate it constantly to overcome the motor symptoms, and they can have a disease-free state. So when we talk about deep brain stimulation, it's not a single person; it's an entire team discuss and decide whether the patient has to go for a deep brain stimulation or they can continue with medication. The surgeon will explain how the batteries is going to be and how we are going to track the wires and how we are going to place the leads. And it's a very safe surgery. And what is more important is it's a awake surgery. Patient can talk to us during the surgery. They can feel their symptoms are getting better on the table when we stimulate the nucleus. So though on the table itself, the patients can make out their motor symptoms are going away. So we confirm it and then we place the stimulator. So most important is the programming. From after placement of the leads, we call them up and we adjust the currents every time. So frequently, initially for the initial 3 months, they need a frequent visits to get over their symptoms. So when the neuromodulation specialist adjusts the currents, the symptoms goes away, and after 3 months they will completely like in a complete control state and independent state. So when we talk about deep brain stimulation, how it changes the quality of life, a patient who is bedbound, a wheelchair bound, can walk independently. This is called reclaiming life from Parkinson's disease. So deep brain stimulations can change who is so dependent on 2 person, 3 person supposed to work, can walk independently with different stimulation. This is a patient, he's a little exceptional. He got a dystonia. Dystonia is normal twisted leg, can't stand. But after different stimulation, he can walk easily. And we talk about successful stories. We treated a lot of patients from outside the country who comes to MIOT and they get different stimulation here, and it changed their life. So, well, patients far off from like India, like Pacific Ocean, there's a small island called Fiji. So he is a trauma dominant patient and he is completely dependent. So when he gets this is 2 weeks, 3 weeks post surgery, he was able to have his food. And this is a lady from Nepal who served for UN. Her position was a pride job. So when she became dependent, it's really something not related to the movement. It's something related to the pride of a patient. So when different stimulations is able to give back their life. So that's what the scope of Parkinson's disease is evolving day by day. And what I want to stress is hope. Hope is seeing light despite of being surrounded by darkness.
Thank you, doctor. That was really interesting and there's a lot of information out there that we did not know. We have a few questions here. Maybe we can start the discussion so that we can also take the sorry, webinar forward. So there's one person, Tangavinesh or Ramasubramanian, he's asked how to differentiate progressive supranuclear palsy and Parkinson's disease.
Progressive supranuclear palsy, we call it as one of the Parkinson plus syndromes. It is not classical Parkinson, idiopathic Parkinson syndrome. Usually, idiopathic Parkinson syndrome, they present with tremor. Initially, they present with tremor. Usually, it starts in hand and spreads to other parts. Like it goes to the other hand and sometimes it travels down to the lower limb. The commonest presentation is tremor, whereas in supranuclear palsy, they usually present with disorders of movement. Initially, they present with slowness in activity and they lose balance at an early stage. They frequently present with falls, especially falling backwards. And they have problems in eye movements that will be detected by the physician. The patient may not complain that, but it will be detected by the physician. So, and the response to treatment is very less in patients with progressive supranuclear palsy. So this is how we differentiate.
Thank you, doctor. So, Maithili Devarajan, she wants to know, can you explain the role of physiotherapy in Parkinson's?
You have active involvement in physiotherapy is very essential in Parkinson's disease. One is the patient themselves, they feel psychologically very good if they are actively involved in exercises. So a good exercise regime, like walking in treadmill, walking out, and then riding a bicycle, static bicycle, and swimming, all will help in disease, preventing the disease progression. There are a lot of papers in that, so which says that the progression may be little delayed with all these effective measures like active physiotherapy. So we encourage all patients to do exercises, regular exercises, if they are in the early stage of disease. That is, whatever that is possible for them, let them do it. So definitely physiotherapy has a role, and it gives definitely psychological advantage over the disease. They feel that they are able to overcome the disease. So physiotherapy is very essential part of Parkinson management.
Thank you. Sir, actually, we would like you to discuss this as a, uh, as we progress here. There is one person, a 57-year-old woman with borderline Parkinson's on medication for the past 1.5 years. So she wants to know, will she become dependent on the medication and will it stop working if she has to, or if she has to take it for the rest of her life?
Okay. Yeah, Parkinson's is something like a genetic role is definitely there. So, how this is the question which we often come across. So, once Parkinson's disease is diagnosed, what will happen to me? So, it is like we cannot take out Parkinson's out of the body. Like someone, if they got a diabetes, they take exercise, medicines, and they have to carry out their normal routines. So, this same like Parkinson's also. Once it's diagnosed, we have to live with Parkinson's, but not to take too much stress about it. Regular visits and a little bit of medications and exercises, we can live their normal life. So disease will progress. The medications dose needs to be adjusted. She will be on medications for a longer time, maybe throughout her life. And if she goes for a regular visits, she can live independent. She will not become dependent. And depends on the stage, the medicines will change, the mode of treatment will change, and she can be better with all these things. There are advanced procedures, advanced medicines are available now. So don't need to fear that.
Okay, is there a way, like we can identify Parkinson's even before we actually, if somebody gets Parkinson's? Is there a way, like you said, the disease progresses probably only at the age of 60. People start your curve shows that. But could there be something like at 30 or 40? Is there a way you can do some kind of
Yes, there are.
investigation and find out?
Yeah, there are ways to diagnose early, but we don't strongly recommend on those points. Like if you look at genetic, it's if the gene is there, and it doesn't mandate that it will develop. Like if the father has Parkinson, the son does a genetic disease, and he may hold the gene. That is not necessary that he will develop Parkinson. So that is on the genetic point. And if it is like there is a complex role between the genetic and the environmental factor also there. So it's not necessary that even he may possess the gene, but he may not have the disease. So early diagnosis we don't strongly recommend. And what when we look at the other disease like the dopamine, the gut is the one which is connected with the brain. We talk about gut brain axis. So there is decreased level of dopamine in the gut cells at 10 to 20 years before all the onset of Parkinson's also. But all these are research modes. So when you look on a humanitarian basis, we don't need to scare them. Yes, you got the gene, you may have the disease. So even if someone in the family do have Parkinson's, the kids no need to worry. They can like live their normal life. They need to aware of these symptoms. That's it. When they get these symptoms, they can consult the physician. And there is no way like to go prior to diagnose, to do genetics, and then to think more about it.
Okay, thank you, doctor. Dr. Subramaniam, there's somebody here who wants to know, does Alzheimer's and Parkinson's go hand in elderly?
Parkinson patients themselves, they are prone for dementia. Okay, so the memory impairment, the cognitive impairments are common in advanced Parkinsonism. So as the age goes, they tend to develop memory disturbance, cognitive impairments, and they have problems in day-to-day living. And Alzheimer's disease, it's a primary degenerative dementia. Okay. They may not have this much of motor problems. Usually, the Alzheimer's disease, they present only with cognitive impairment. Start with memory impairment and then difficulty in performing day-to-day tasks. And they don't usually get tremor or slowness or rigidity in Alzheimer's disease. They have problems in going out. They have problems in wayfinding difficulties, all that. But both are degenerative, neurodegenerative disease. This comes under one spectrum, and that is the other spectrum. The Alzheimer's disease comes under dementia, whereas Parkinsonism it comes under movement disorder. Both are different entities.
Okay, so there are two questions about this alternative systems of medicine and of course diet and exercise. So there are this question about whether Indian systems of medicine, has there been any study which can supplement treatment for Parkinson's? That's one question. Another is if there is a family history of Parkinson's and naturally one may not be able to avoid it, but then actions like diet, exercise prior to being diagnosed, is there a possibility that you can avoid getting Parkinson's?
Okay. The genetic component is it's little common in young onset Parkinson's disease. It is not that common in late onset idiopathic Parkinson's disease. Genetic association is not that good. Okay. So there is no way of detecting doing genetic tests, and one should not be afraid of being a Parkinson disease son or a daughter. So siblings should not be afraid of that. So, and there is no specific diet which will prevent Parkinson's disease or which will delay the progression of the disease. They can have normal diet. With medications, there is some adjustments, especially patients who are taking levodopa, they can have little bit of adjustments with their protein diet. Otherwise, there is no specific diet which prevents Parkinson's disease or which delays the progression of the disease. They can have their normal diet. Of course, exercises, I told you before, active involvement in the exercise regime, it will definitely help.
Okay, there is this question about is the supranuclear palsy, is
Okay.
it the same as Steele-Richardson syndrome?
Yeah, both
What
are synonymous.
synonymous? Okay. So then there is this question about what is the success of deep brain stimulation, and what are the risks?
So, yeah, when
And
we talk
this
about success of deep brain stimulation, it's the ideal candidate. We talk about ideal candidates. So, how we identify ideal candidates is initial 4 years from the point of onset of symptoms. We don't talk about deep brain stimulation. We see how they are responding to medicines. After 4 years, the disease which mimics Parkinson's can be ruled out reasonably. At the end of fifth year, we won't if any other mimics Parkinson. For say, for example, progressive soprano mimics like it mimics Parkinson. By the end of 4 or 5 years, we'll be easily able to differentiate. So we won't do deep brain stimulation for Parkinsonism or Parkinson plus. For idiopathic Parkinson's, we ask them to undergo three clinical tests. The one is when we give dopamine, how he is ambulant, and when we stop dopamine, how he is ambulant. This is one important thing. There should be at least 30 percentage improvement or difference between with dose and without dose. And second things is we ask them to undergo a neuropsychiatric counseling and therapy. Third things is about the medications. There should be some response to the medication. That is what. So with these three tests, we come up with a scoring system. 0 to 10. The score of 6.5 and above, they are the ideal candidate, in which the results are 100% sure. So those who carry a score of 3.5 to 6, they will have intermediate. Means some of the symptoms will respond, some symptoms we need to tackle with the help of medications. And those who are less than 3.5, we should not do deep brain stimulations for them. That's how the success or the effectiveness of deep brain stimulation is distinct.
So you actually decide on which is the right patient who can go for DBS, is it?
Yeah, everyone,
You
it's
evaluate the patient.
we need to evaluate. Simple
And
evaluation.
how long does this evaluation go on? How do you decide that a patient is, you did say something about this point, the percentage point of movement of this person. But how well would a person take it? Suppose somebody is saying, I want DBS simulation, but then you would say, no, no, I can't give it to you. How do you explain to him or her that they don't have a choice?
Yeah. So when we, many patients comes with these things, I want deep brain stimulation. So how we answer them is like deep brain stimulation is given for a disease which has got no cure, and we are not taking the disease out of the body, but we are making them to live better. That's the purpose. So even if he has deep brain stimulation, it should change his life. He should go back to his normal life. So if we are not able to get, then there is no point in like giving or offering deep brain stimulations. So there are many other ways to make them better, like apomorphin or a pump. So exercises for Parkinson plus disease, exercise has an important role. We give solutions, we give the right solution, and it's a team which decides it. So we don't offer for all. So it should change their life.
Okay. So here is one person who has said he's 42 years old and he has Parkinson's disease for 24 years. In 2019 December, he had a DBS done. His stiffness has increased. Why does the medication pain from the? I think I don't get it. From the first dosage, he's saying. I think he must have been on medication, but then the pain hasn't reduced, or maybe he wants more dosage. He wants you to increase the dosage. Is that possible? Is what he's asking. I think.
Okay, pain is one of the non-motor symptoms. It is what is non-motor is if something is not connected with the movements, we call it as non-motor symptoms. It can be pain, it is, like it can be constipations or any other. The pain is a symptom of Parkinson's disease. So what is or we do need to get away with the pain? So there are drugs which like a syndopa or the dosage needs to be adjusted, and then if there is a side effects, then we try to split the dose at frequent intervals, and then we tackle. So when they take dopamine, the pain goes off. So what he needs to do is consult a neuromodulation specialist with all the documents, and when we go through his records, we will have more idea like what is running behind. Deep brain stimulation takes care of motor symptoms. Non-motor symptoms, medication has a definite role. So for the pain, though DBS will not directly address the pain, but by adjusting the medication, pain can go off.
Okay. Dr. Subramanian, here is some. See, we've been talking about environment playing a role in Parkinson's disease. What kind of, what do you mean by environment? Do you mean the pollution in the general environment, the increased industrialization, or the inability of people to, to have a proper time frame to be able to manage their time, go for walks and stuff like that, or is there something else that you're talking about?
Environmental toxin means usually those who are exposed to some abnormal chemical substance. There are no data regarding pollution in urban areas, but there are reports that the farmers who use pesticides, insecticides, there has been some increase in the incidence of Parkinsonism with them. But we don't know whether it is a causal association. But there are reports. But urbanization, industrialization, there are no definite evidence that industrialization is one of the main, at least the cause for Parkinsonism in urban area. There is no data regarding that. So toxins, insecticides and pesticides, there are reports. There is a mild increase in the incidence among farmers who use that.
Okay. So here's somebody who says her father has experienced freezing issues late in the night or in the morning. He is on 1 by 2 Syntopa thrice a day, and the last dose being at 5 p.m. She wants to know how to handle the freezing issues. I think her father's limbs freeze. I think that's what she is explaining.
Yeah. What is freezing is the feet will stuck to the ground and it will be difficult to clear the ground. It will stuck like you can't move the legs as though it's glued to the ground. So that is what freezing. Freezing is a symptom of Parkinson's. And how to get away with freezing is there are visual clues. So when we look at the feet, then the feet will be off. It's a technique we often teach them. Sometimes we advise them to use laser lights. So when they try to move their leg, they can't move, but with the help of visual clue, if they look at the laser light, when they try to grab the laser light, they will be able to do it. So freezing can make them fall, and fall is not good in Parkinson's. So visual clues is one which is very simple to follow. Use a laser light, ask her father to step over the laser light, then he will be able to walk better. So visual clues, that's a solution for freezing. In exceptional cases, we inject botulinum toxins in a small quantity into the calf muscles, and it can help. Like it might help also.
Okay, so here's something. Can a patient come back from Parkinson's without medicine but with physical rehabilitation? Is it possible?
So
No medication, but just physically, I think physiotherapy and
yes, yes. That's an early stage, a very early part of the disease. It's called the honeymoon phase of the disease, where they can, with help of exercises, they can do. But as the disease progress, at some point in time, they will definitely need medications. So the initial phase, we recommend only physio. We may not even write medications for patients with a little bit of slowness and things. We advise them to go for regular physiotherapy and exercises, and we keep them on a close follow-up. At one point in time, they will need medications.
okay. So again, this is one question for you, sir. You have not mentioned about basic sniffing test. One diagnostic test that is being followed abroad, he's saying.
So this is when diagnosing Parkinson's. One important is about the smell. Like the patients with Parkinson's disease, one of the early symptoms, they fail to like perceive the smell. So when we test about the things, when by the time the patients comes, they will already will have all the motor symptoms. So smell is one when we like when we need to know it is on the early stage before the motor symptom starts, then smell has a role. Because that is one of the early sign of Parkinson's disease. If the patient got admitted for something else, and then when we interview them, we need to know whether Parkinson is there or not. Smell helps there. It is recommended to do include a smell as one of the diagnostics. But when they present the other major signs, the telltale signs, we call they are sufficient enough to diagnose Parkinson's disease. And smell is something which is done routine in an academic way of establishing a diagnosis.
Dr. Subramanian, I have a question for you. This one person was asked, can speech therapy help improve speech disorders? Now we saw there was a video where the swallowing was a difficulty for somebody. Uh, so swallowing, I think, is a different act altogether. But then even speech would it be blurred, or would people be tripping over words? How does it work?
Definitely, Parkinson patients will have speech problems. One is that they speak in a low voice
Oh,
because the muscles goes for the spasm. Similar to the spasm outside, the laryngeal muscle it goes for spasm. So they speak in a low voice, and when they try to speak, there may be fast, there may be slurring also. They do get the slurring also, and with drugs, they should improve. That also should improve. And there is a definite role for speech therapist. Okay. They will guide them how to coordinate their speech, at what time, how much pressure they have to put on those words. So definitely, speech therapy has similar to the swallowing therapy. Speech therapy has a definite role in Parkinsonism, and definitely medication is going to help them in overcoming their speech problems.
so here is somebody who says, my father is at stage 4. He can't walk independently. He needs support for all his activities. He has hallucination and memory issues. Can he recover from Parkinson's disease? Will an operation help? I think that he means DBS. And how much will it cost for the operation?
So yes. So when somebody says they are in stage 4 of the disease, first things is to confirm it, like how bad they are, or the medicines are helping them, or sometimes the medicine per se will cause hallucinations. So when the medicines are causing hallucinations, we need to pull back a little. Like we need to come back. We need to reduce the dose to get away with hallucinations. And there are medicines which can counteract the hallucinations also. And what is important in stage 4 is the challenge test, the DOPA challenge test, how much they are going to respond to dopaminergic tablets. So with dose and without dose, if there is a significant difference in them, then different stimulation will help. So, but somebody who is already bedbound, who doesn't respond to medicine at all, or the medicines are bringing about very intolerable side effects, so then the stage is already gone out of the hands. So in that case, we don't offer deep brain stimulation because it's not, the cells are reducing in number. We need something to stimulate. When there is no cells, we can't even put a chip and then stimulate anything else. So the stage, when they talk about stage 4, so we have seen patients who comes in a wheelchair. I have seen a video. He couldn't walk. He was completely wheelchair bound. So wheelchair bound or bed bound is the last stage we talk about. But when we analyzed him, he was not able to walk because of some other causes, twisted legs. So when someone comes or someone asks when they are in stage 4, they need to undergo a simple physical examination and a little bit of dopamine challenge. So with these two tests, we'll be able to gather so much information whether the deep brain stimulation is going to help them or not. So that's what. So when we talk about the cost of the surgery, the cost versus the benefit is the one we talk about the things. So depending on the stage and the age, there are different batteries which comes and then helps. So after consultations, like we discuss openly and then we come up. This is affordable. This is not so expensive that a family can't spend for it. So it depends on the battery. The prices differs.
Is it covered by insurance, the health insurance?
Yeah, definitely. It's covered by health insurance, and some have a part pay and a part insurance also. So we are working on a thing like multiple parameters to help the family.
Okay, thank you, sir. So there's one person here. I'm 74-year-old male from Chandigarh, diagnosed with drug-induced Parkinson's disease for the last 8 months. There is bradykinesia and a little tendency of loss of balance, restless legs. Put on pamipixole 0.25 mg BD. Is it reversible? He's asking.
Yeah, as we talk about the environmental hits, there are some medications like most of antipsychotic drugs on long term can cause Parkinsonism. What is Parkinsonism? Is something similar to Parkinson but not Parkinson's. It's called Parkinsonism. So these medicines they damage the structures in the brain. They impact the circuit, and when the circuit gets impaired, then it cannot function properly. So if they are in the early part of the disease, once the medicines are stopped, the circuit tries to function back normal. But if they took medication for a longer time or a large dose in a short term, the damage becomes permanent. So there is a way that there comes the role of advanced nuclear scans. So we analyze the circuit functions, how it is, how well it is. And if there is any structural damage or worse damage, then the symptoms cannot be completely cured. They have to live with it, but medicines can bring a little bit of improvement in their symptoms. Pramipexole is a very good drug, but
Uh, Thank you, doctor. There are quite a few questions about how do we diagnose. Before Parkinson's, even somebody is affected with Parkinson's, is there a way to prevent it? A lot of people are asking about this. Can you explain, Dr. Subramanian?
Okay. There is nothing called, early diagnosis. Once you start developing some of the symptoms of Parkinson's disease, like a tremor, you go to a physician, evaluate yourself whether it is Parkinsonism or is it something, the tremor is something else. So if there is a family history, like somebody, some parent or someone is suffering from Parkinson's disease, and if the Parkinson's disease is young onset, if you suspect clinically it may be of genetic origin, okay, then you need to work up for that. So the initially, so we do a basic MRI and some of the blood tests also there. Sometimes young onset Parkinsonism, there is one disease called Wilson's disease, which mimics uh, Parkinson's. So we rule out. See, there are usually it starts in very early age group. Wilson's disease. Sometimes it starts little late also. We've seen a lot of patients with that. So we have to rule out that also. There are Parkinson mimics which we have to rule out before diagnosing the patient has Parkinson's disease. So for that we need tests, basic brain imaging, blood test, and then ultimately you do a F-DOPA PET. So these are all the diagnostic approaches for this. So once you have symptoms classical of Parkinson's disease, you have to go through these steps. When you are in doubt, when you have vague muscle pains, tremor due to anxiety, it will be evaluated by the physician and they can easily, clinically, they can say that it is not Parkinsonism. So the best way is to go to a physician, assess yourself, and then go for the investigations if required.
Doctor, there are quite a few questions here. And one question is, my father got detected with Parkinson's disease in 2019. He was very much active till February 21st. However, since the last few months, his health has been deteriorating. He walks very slowly, is not able to um, move properly, but is able to eat and sleep properly. What is the next step you would recommend and advise? He's in Pune and he's with me, he says. This lady here.
Usually, if you see the general course of the Parkinson's disease is um, they slowly progress over a period of time, maybe 6 to 8 years. They tend to be static. So after that, only there will be progressions. This is seen most of the patients. Some patients there may be rapid worsening. If there is a rapid worsening, you have to rule out Parkinson plus syndromes. So multi-system atrophy is one type, and progressive supranuclear palsy is Parkinson, is one type of Parkinson plus syndrome. So we have to rule out. So this can be done clinically as well as by investigation. Okay. There are scans available, the F-DOPA PET and then the FDG PET scans. These will differentiate whether the patient is really suffering from Parkinson's disease or Parkinson plus syndrome. So patient requires detailed evaluation now. Since there is a rapid progression, we need to reassess whether the patient is really suffering from Parkinson's disease or is it Parkinson plus syndrome. Or sometimes there may be some worsening of Parkinson's due to infections, like an UTI, urinary tract infection, can also produce worsening of symptoms. And then any reduction in the sodium level in the blood can also produce um, uh, these kind of worsenings. So we need to find out what the real cause is. So the patient has to be taken to a physician, nearby physician, to assess what really is going on.
Okay, so there's one question here. Do cardiac medicines, do they cause Parkinson's disease? They're asking.
Generally, cardiac medicines don't produce, but there are reports that amiodarone, which is given for cardiac conduction abnormalities, arrhythmias, produces, if it is taken for a long time, can produce Parkinson-like syndrome. But if we find out, if we detect that, we can stop the drug at the initial stage, and then it is usually reversible. So that is the only drug. Anything?
Yeah.
There is a question here. Uh, if somebody who has non-vegetarian diet, will it subside the effect of levodopa? They're asking. Levodopa.
Food and levodopa is for any food, for that matter, will impair the absorption of levodopa. It's not specific about vegetarian or non-vegetarian. So we recommend them to take in an empty stomach so that the absorption is good, the action is faster, it reaches the blood level faster. So we recommend levodopa to take it in an empty stomach. That's the relation between levodopa and the food. Food for any matter, like anything, will impair its absorption. So empty stomach, faster action, and complete absorption.
Okay, so here only when I take my medicine, the rigidity increases and lasts for an hour. Why does this medicine cause a lot of disturbances for the last 24 years? Why do I feel very uneasy?
Okay. So when we talk about treatment and the symptoms, so not every patient, not two Parkinson's will be the same. So the treatment is something tailor-made. So some will have a tremor as a dominant, some will have a rigidity as a dominant. So when something rigidity is more, the medications has to be more specific. The drug will not have the same effect. So the person to person, the effects also vary a little bit. So it's completely tailor-made. If she does have the symptoms of rigidity, for rigidity is a wider thing. They use it for stiffness, they use it for reduced flow, they use it for cramps, they use it for fatigueness. So she has to consult a neurologist or a neuromodulation specialist or a movement disorder specialist and explain her symptoms. And it is a problem which can be addressed and can be treated with the help of medicine. And physiotherapy definitely helps to get rid of rigidity. Simple stretch exercise will help her definitely.
We I think we'll conclude with this one last question. They are saying if somebody goes on this Indian systems of medicine, alternative systems like Ayurveda or homeopathy, will it produce side effects and will it cause more problems to the already existing Parkinson's disease? What kind of side effects can you expect, Dr. Subramanian?
Yes. We don't have any sufficient data in the mixing of treatment regimes. Okay. So I think you stick on to one form of treatment. Uh,
Okay.
Either you carry on with your allopathic medications or you stop all the allopathic medications, start taking herbal or Ayurvedic, whatever medicines they are taking. It is better not to mix things.
So there is another question. I think we have just a couple of more questions. Will meditations help somebody with Parkinson's disease? That's one question. Another question is it normal to get leg cramps in the morning while walking? Or is it a symptom of PD, is what they are asking
No,
again.
no, no, no. See, the muscle cramps after walking. So that is a totally different. See, patient is normally walking. If he gets a muscle pain, they have to be evaluated why it is. So if there is even a blood flow reduction, or if they have spinal cord problem, they can have muscle cramps and pain while walking. So we call it as claudication. So this can be either a vascular claudication or neurogenic claudication. So pain and cramping while walking, you have to rule out vascular as well as neurological causes. Unlikely to be Parkinson's disease. Parkinson's disease presenting only with muscle cramps is quite rare. You have to have other symptoms to say that it is Parkinson's. That part is it's unrelated. Um, okay.
Okay. And meditation. I think we'll close with that.
Okay. Medications, I think it is
Meditation. Uh,
meditation.
meditation.
Meditation, there is no data regarding that meditations. There is no data regarding meditations. Physiotherapy, yes. Active exercises, okay. Diet, okay. Then speech therapy, swallowing and speech therapies, they are accessory part of your Parkinson treatment regime. Meditations, we don't know. There is no documentation. There is no trials in that. I mean, good trials in that. So if Dr. Shankar knows anything.
Yeah, so it's about the movements. Like even yoga is a form of a movement, which helps in stretchings and things. So exercises, maybe physiotherapy or something in yoga, but meditation is no evidence to talk about meditations and Parkinson's. Exercise is one definitely which will help to get away with the motor symptoms. They do have a role.
Okay, thank you so much, doctors. There's no time anymore. We'll have to wrap up here. Thank you very much, and let's hope that this Parkinson's Day, when it is being observed, lots more people have much more knowledge about what it is, and how to take care of themselves. Thank you very much for being
Thank
on
you.
this show. Thank you.
Thank you. Thank you very much.